Okay, then. All right. So one of the things I heard you say that was important to you was to make sure there's some more mental health resources in schools. What is it that you would recommend or suggest to improve the mental health that's offered at schools, if there's any at all?
Yeah, well, there are sort of some. It depends. Like at our school, we have a family counselor who is available to students and their families. They set up appointments. And we have guidance counselors. The problem is that guidance counselors don't get to do guidance. They guide in terms of course selection, but they're also required for testing. They're required to do, different duties, and we have to make sure just they want to be available. There are also a lot of we call them off-the-shelf programs that are available for free to different places. Like there's the Sandy Hook Promise has a program that's available. There's they changed the name, the Lighthouse Project. It's through Colorado, where they have programs where they can train teachers and they can train peers to be able to look out for things that other peers might be exhibiting. So that a lot of times it's a matter of catching it before it gets too far gone that you can't, catch the student before they're too depressed or they're suicidal and things of that nature. So I think we need to take a little off the plate of the guidance counselors so that they can actually work with students in a way that they want to and start to implement some programs into our system. Like we had a Sandy Hook Promise program. The guy came one time for an hour at our school, but nothing really went further than that. So we just need to make sure that we're following through with those programs and offering them with fidelity.
Okay. All right. So I heard you say like a couple of things. The guidance counselors have too much to do. We don't want to add more to their plate, right? But I had a guidance counselor. I don't think they had a degree in like psychology or mental health therapy or anything like that. So I don't know how it is that they would have been able to provide that service. Is it, I mean, I went to school a long time ago. I graduated from high school like 30 something years ago, right? So things are might be different right now. But is there like a person that's in the schools that deal with mental health, or are the guidance counselors, do they have that type of degree or that type of training that they could identify something that's going on with a student that may have a mental health issue?
So it depends on the school and it depends on the guidance counselor, but I would love to say that we need to bring in mental health counselors. There's a department at the district that does have mental health counselors, and were awarded a grant where they're going to start to bring people into the schools. So they wouldn't be at one school all the time. They would rotate through, but there are people in the district that you can contact if you need like a psychologist or a specific counselor. And like I said, at our school, we have 2 family counselors that could provide those services, but they're so busy, it's very difficult to get them. But I don't want to say we should provide, of course, if we had all the money in the world, we should have a dedicated mental health professional that was in our schools to be able to work with the students. But within the confines of what we have, because everyone says to me when I say an idea, well, how are you going to pay for that? We don't have that. But if the guidance counselor is a place where students can feel that they can go when they're struggling or have a problem, then they do have, it may not be true mental health or psychology or like a psychiatrist, but they are trained in that. Like we have one that's in charge of if someone is in danger of suicidal, they go to that particular guidance counselor. So they do have training in those things. So it would be a place to start. But I mean, if we could have lots of money, I think that we should have obviously mental health service people within our schools, not just for the students, but for the staff too.
Right.